Hi, we're Team 6, and we have a question for you. If the therapy you needed had a 1 in 3 chance of causing you more harm than good, is it an effective therapy? I'm Kieran Tremblay.
I'm Lana Neidig.
I'm Priscilla Anand.
And I'm Emma Smith.
And we are determined to solve this issue, which plagues intrathecal therapies for cerebral palsy. First, let's take a quick look as to why intrathecal therapies are necessary and determine why the catheters they rely upon need an extensive overhaul. Cerebral palsy is a relatively common disorder that affects a person's ability to balance and locomote and causes excessive spasticity. Modern therapies for this disease include Baclofen treatment, which can be delivered orally or intrathecally. Intrathecal therapies pump the medication Baclofen from an abdomen-implanted pump through a catheter directly into the spine. However, almost 33% of implanted Baclofen systems experience catheter failure caused by internal migration. These failures lead to the leakage of medication, which can cause withdrawals or death. Just as a disclaimer, I'm about to show a surgical image. These failures also require costly involved surgeries to fix. We can redesign the catheters to be more wear resistant, less modal, and better integrated into the body to help these patients.
So here's our approach to solving this issue. We'll be using bioinductivity throughout our fabrication of the catheter. The tubing would include a dual layered tubing design with an internal layer of silicone and an external layer of PET. And there would be 2 different coatings, one for the catheter parts in the cerebral spinal fluid and one for the peritoneum. The one for the cerebral spinal fluid would include enzymes that would help with remodeling of collagen, as well as hydrophobic proteins to allow for collagen to attach to the tubing itself. The coatings for the peritoneum would include different transcription factors and growth factors in order to allow for fibroblast growth and attachment, as well as remodeling of elastin proteins and upregulation of the creation of those elastin proteins. Here is a bit of a diagram as to what specifically will occur or what specifically will be in each coating and section of the catheter.
With that, let's examine the costs and benefits associated with modifying this device. This innovative method improves the longevity of the catheter following implantation. And with this, it reduces the need for revisional surgeries, which are costly and also invasive. Overall, this improved system would further lower the costs of an expensive but necessary treatment. On average, an intrathecal Baclofen pump costs around $28,473 in the first year, with most costs linked to the surgery and subsequent hospital stay. So prices are expected to decline by the second year. On average, intrathecal pumps cost $8,000 less annually when compared to other treatment methods for muscle spasticity.
Speaking of those methods, let's look at some alternatives. We've got oral delivery, which is usually a first solution because it's non-invasive. However, it requires a higher dosage because it needs to cross the blood-brain barrier and thus has elevated side effects like fatigue, nausea, and dizziness. Unmodified intrathecal delivery allows for a lower dosage by bypassing the blood-brain barrier, but it's highly invasive and requires surgery for implantation, as well as post-implant surgeries like those for pump end of life and complications like catheter migration, as illustrated to the right, where you can see a migrated catheter in an open V-wing anchor. Options on the market include the Ascenda catheter, which features a silicone inner layer, a polyurethane outer layer, a PET braid, and is generally designed to be kink resistant. We've also got Prometra, which was approved for use in 2020, and it features some ideas for increased and better facilitated dissemination. However, these both are still susceptible to migration issues and do not work with the body's natural tissue response in the way that ours does.
Finally, who does this product benefit? This improved device best benefits individuals experiencing muscle spasticity associated with cerebral palsy that either aren't receptive to oral Baclofen treatments and/or experience major side effects. Specific clients include cerebral palsy patients, their caregivers, and healthcare professionals who are involved in every step of the way in the patient's treatment process. And with that, we'd like to thank you for your time.